Hello, my name is Brianna Easy, and today I will be doing the Module 3 discussion post, synovial joints. So, the synovial joints that I'll be talking about today is the sternoclavicular joint and the acromioclavicular joint. The sternoclavicular joint is a saddle joint that has 4 ligaments that helps perform multiple complex movements. The acromioclavicular joint is the acromion process of scapular distal end of the clavicle. So the next topic is articulating surfaces. The articulating surface for the acromioclavicular joint consists of articulation between the lateral and end of the clavicle and the acromion of the scapula. The articulating surface of the sternoclavicular joint is formed by the sternal end of the clavicle, manubrium of the sternum, and first costal cartilage. So the major ligaments for the sternoclavicular joint is sternoclavicular ligaments, which is anterior and posterior, and it reinforces the joint capsule anteriorly and posteriorly. The interclavicular ligament, which attaches to the sternal end of both clavicles and reinforces the joint capsule superiorly. The costal clavicular ligament, which attaches the first rib and costal cartilage to the inferior surface of the clavicle. The major ligaments for the acromioclavicular joint is acromioclavicular ligament, which runs horizontally from the acromion to the lateral clavicle, and the coracoclavicular ligament, which suspends the weight of the upper limb from the clavicle. Okay, so other anatomical features, the scapulothoracic joint has muscles attached to the scapula that helps permit its motion with the trunk and the thoracic. It helps facilitate movement of upper extremity through appropriate positioning of the glenohumeral. So joint by shape and function, the sternoclavicular joint is a saddle joint because of the articulate disc. The function of the sternoclavicular is multi-axial. The acromioclavicular joint is an irregular joint because it allows movement in all 3 planes, but the movement is minimal. The function of the acromioclavicular is axial. Okay, so movements allowed by the joints are protraction, which happens in the transverse plane through the y-axis, retraction that also happens through the transverse plane but through the x-axis, elevation, which happens through the frontal plane and that is through the z-axis, and depression. So to show you, protraction goes forward, retraction goes backwards, elevation is the lifting up of the shoulders, and depression is going down with your shoulders. Thank you so much.